got a couple things going on, but now that I'm looking at your back, can you show me where you're feeling it, both here and there, and then we'll take a look at your hand. So, you're feeling it in your low back more here? Or?
More on the right side. It gets to be stiff when I'm walking and during the day when I'm moving it.
And it
will be maybe here, this portion. I can tolerate it. It's kind of stiff. I think it's kind of dull, but I know that there is pain there.
Okay. And this, so you have pain in both, like behind your knees and in your heels just started?
Heel, yeah. Yeah, when, I don't know, maybe because of the walking I do at work.
Okay.
It's not normal, I think.
Okay.
Because it's after getting up in the morning that I feel the pain.
Okay.
I don't know, maybe some...
Oh, so it's only really in the morning?
Yeah, when I get up in the morning, the first steps I have, there's some pain on my heel.
Got it.
Yeah, and it goes away.
Okay.
Then...
And but right heel is a little bit more, right?
Right heel is a bit more, I don't know, it's something with my nerve.
So it's kind of the nerve, like I was saying, but the reason why it hurts more on the right side is because your pelvis is twisted, like I was telling you before. Mm-hmm. So basically because your hip is dropped and twisted on that side, I'll just show you really quick. So your hip, right, it's dropped like this and it's rotated like this. Mm-hmm. So what happens usually when people have that is if you put more pressure onto your heel on that side, and then over here you typically, it's called pronation. This one actually just twists in more like that. Yeah. Right. So it's kind of like this. I mean, I'm exaggerating, obviously. Yeah. So that's why you feel it a little bit more. Yeah. Yeah. So we'll work on that in a bit too. So, but this is what I'm most concerned about, obviously. So that's you involuntarily.
That's involuntary. If I notice this, then I'll just put it down, but you know, it keeps on going up.
That's pretty quick. So just right when you put it down, it starts going up more and more.
Yeah, there we go.
And just keeps going up more.
Yeah. So in the office, when I'm on my computer, especially typing, I put my other finger like that. So just to control it, and so this one is dead already, so I'm not using it.
Got it.
And at the end of the day, of course, because of that one, I feel the pain right there. It radiates my back.
Got it.
And I think it's a bit swollen. And now there is some pain here. I don't know, because this is pulling up and some ligaments or muscles are being affected.
Yeah. So what you're feeling over, like I was telling you, here to here to here, they're all related to each other. So if you have problems here, your radial nerve actually comes through here. Now the radial nerve, like I was telling you, very specifically goes down into the back. I know you feel it like here, when it kind of goes here, but it goes into what's called the extensor group, into here. So that's what attaches here, and it kind of goes over here, and it makes your fingers go like that, right?
Now it's affecting my eating, when I'm holding up my spoon, when I'm brushing my teeth. So I want it solved.
Yeah. That's
the pain I think I could tolerate, but how it affects my daily chores, daily life.
Because your grip is getting weaker and weaker, right?
Yes.
Okay.
And also find it not hard, but strange to do the daily tasks that I normally would do very easily. But as I said earlier, I don't know if it matters, but it first started off with a bit of pain here. So I saw...
It does matter, yeah. Over here, we're trying to see, hey, where's there possible inflammation, right? So this needle swings when there's possible inflammation, and swings pretty hard. We correlate that with what we see on the x-rays, which I already showed you on the x-rays.
Yeah.
Is that tender over here? A little bit, right?
A little bit, yeah.
Okay, I'm just looking at how your neck is moving through there. And there's definitely one prime culprit that's not moving. Right there. Is that tender here?
Yeah.
Yeah, okay. Let me work on this first, and then we'll work further down. We always look for the spine first, so... Okay, I'm going to give this a little push forward, okay? So you just relax here. I gotta release the nerve a little bit. Good. Okay, so I'm gonna have you do is just relax here. I'm gonna adjust what's called your radial head, okay? Okay, just relax a little bit. Get her. Okay. Let me just pull it up a little bit, so just relax here. Good. It looks a little different.
Yes. It's not going up as fast
Yeah.
and as high.
We'll get you better. I'm actually not gonna adjust your low back today, because I want all the healing energy to just go over to what I adjusted over there.
This finger wants to go near this finger.
Yeah, but not up. Yeah.
But up.
So that's progress. What happens with nerve problems is it started there, and then you started getting in here, and then you started getting here. That's what we call double crush syndrome. So basically, it doesn't necessarily need to go from there to here. It can actually go from here to there too, right? So as it gets more and more chronic, it starts going up and up further, up into the nerve root. Yeah, so we just know it's chronic, so we're gonna have to work through it. So I worked on that part of it, and this part, we might need to do a little bit more with it. And I'm actually gonna give you some nerve tension releases too that you can actually do at home as well.
Okay.
Yeah, but I'm not going to do that just yet because I just want to see how the adjustment does. Yeah, so we already did a lot, so just kind of, you can rest, don't do too much with it. Just be aware of looking down too much too. Yeah, just try to look more like horizon versus down. Yeah, because of the way your neck is positioned, you can put more stress onto that joint if you keep looking down. Yeah, so just let that joint settle into place, and let's just see how that does for you the next time. Yeah, I'm positive we're gonna make some difference. That's already like one adjustment, and it started making some difference. Yeah, so next time, just let me know how that does, and then we'll kind of keep working through it. It looks like it's got some good improvement. Let's just see one more time because we let some time pass. Just sit there. It's interesting. It's different.
Yeah.
It's definitely different. It's going more that way, and it has less of an up component. Before it was just completely up like that. Yeah, like that. Yeah. Now we just have that component.
There's definitely an improvement. I would observe how I would do with my routine chores, like in the computer and typing, so on and so forth, eating and other things. Yeah, because I noticed that lately.
You know,
even drinking my coffee is already bother.
got it. Well, what we should have done was actually have you use our dynamometer, you know, the grip test, like before and after. Yeah, but you'll notice with your coffee mug will be your dynamometer. So you let us know next time how that does. Yeah. And I'll see you next time.
Okay. Thank you.
Not too bad, right?
Yeah.